Hello, my name is Michelle Foisey. I'm a clinical pharmacist that works in the area of HIV. So I'm based out of the Northern Alberta program here in Edmonton, Alberta. And I'm at the Royal Alexandra Hospital site where we see about 500 patients of the 1,500 patients that our clinic serves. I'm also clinical associate professor with the Faculty of Pharmacy, the University of Alberta in Edmonton, Alberta. About a year ago, we launched the Patient Care Process Group, and I was chairing this group. It consisted of a number of different people from various practice sites. So it was a nice cross-pollination of community pharmacy, ambulatory practice, inpatient pharmacy, as well as the Faculty of Pharmacy. So I hope that you find the tools that we've developed valuable and that they'll serve you well in your practice. And I also hope that you enjoy this module on how to precept your student. Thank you.
Hello, this is Michelle Foisey again. I'll be reviewing the pharmacy care plan with you. So before we get started, I'll just present a brief outline of what we'll be discussing today. First of all, it would be setting the stage for precepting the pharmacy care plan. We'll be reviewing the elements of the care plan and how to provide feedback and evaluation to your student. Following that, I'll be reviewing the overview of the preceptor role. And finally, I'll give an example to you of my practice. So the first step is setting the stage. And in this case, these are just guidelines and questions to help you to define your practice with your student. It provides the student an overview of how you deliver your care and the structure of your patient care practice that supports this activity. So let's just run through some of these questions. Firstly, what is the flow of patient care like at your work site? Do you work independently or in a collaborative type of model, perhaps on a multidisciplinary team with other healthcare workers? What is the scope of your practice? Do you specialize in a certain area? Are you a consultant? What types of assessments do you do? How do you implement your care plans and who takes on that responsibility? Do you have prescribing authority? Are you able to order labs? Do you provide immunizations at your site? Who typically provides monitoring and follow-up? And how does seamless care and communication occur with other healthcare providers? Now that the student has gotten to know your practice site a little bit better, it's time for you to get to know your student. So the first step would be establishing a relationship with your student to learn how many and what types of care plans they have already developed and implemented. What worked well for them? What was the most challenging? What aspects of the care plan do they need the most assistance with? And what areas are they already confident with? Following that, you can share your approach and the expectations for developing and implementing a care plan in your site. What level of detail do you require? What are the students' responsibilities initially after they gain experience? And how will you provide that feedback to them? Can any elements of the care plan be communicated to others beforehand, before you actually review the plan with your student? Setting clear expectations for your student is important to ensure that care is delivered in a way that you feel that maximizes patient safety, all while allowing for personal comfort. Here is the pharmacy care plan worksheet that the faculty is now using in the curriculum. It is a bit difficult to read on this slide, but a larger version is in the patient care process document. Also, the next slide will briefly discuss each of the sections. This is a standard framework that we will expect students to be comfortable with, and also helps to ensure that they don't forget any steps in the process. There are 6 main elements in the pharmacy care plan worksheet. The first one is the medical conditions. Following that, goals of therapy, different alternatives, recommendations and plans, monitoring parameters, and follow-up. And I'll just briefly run through each one of these. The first one would be once the student has had the chance to assess the patient and identify any drug-related problems. These would be listed here on the sheet in the first column. In addition, medical conditions that are ongoing or chronic can also be listed here even if there's no drug-related problems. Because in a care plan, it's still necessary to monitor patients for ongoing care, despite the fact there might not be a drug-related problem. Following that, it is important to consider the goals of therapy. Realistic and patient-centered goals are important and can be achieved through discussion with the patient. So try to encourage your student and assist them in developing patient-centered goals that are realistic in your practice site. Once that is done, then different alternatives can be compared and make sure they are realistic and relevant. It would be good to look at both drug and non-drug therapies and list the pros and cons of each of these relevant, realistic alternatives. Once you've done that, it's time to actually make a recommendation. So of those alternatives, what is the best plan for that patient? It would be important for a student to actually provide rationale for the chosen plan and also to have a few backup plans in hand and to be proactive and be ready to implement those should the first plan actually not work out. Once a plan is implemented and developed, it's important to establish monitoring parameters. These include both parameters for efficacy and safety. So in this, we're looking at the degree of change of a parameter and the time frame for change. So let's look at an example. Say you have chemotherapy-induced neutropenia. So what is a clinically significant drop in the absolute neutrophil count? And when is the onset of this adverse effect anticipated? The follow-up should include who, how, and when this follow-up will occur. And this will really depend on your practice site. The pharmacy student should be aware of the flow of care and what part of care the pharmacist is responsible for. Finally, when the patient does come in for follow-up, it's important to review the outcomes of therapy and to compare these actual outcomes with the goals of therapy that were initially set out. It would also be important to review the safety and efficacy parameters, to look for adherence, and see if there's any new problems that can be identified at that time. A new plan for ongoing monitoring must be implemented in order to prevent the new problems from occurring. So each time the patient is reviewed, the care plan must be revised accordingly. All right, so we've reviewed the actual components of the care plan, but let's take a step back and talk about the care plan worksheet in general. We want the purpose of the care plan to be clear to preceptors. So while we conduct many aspects of the assessment and care plan in our heads as clinicians, the student is actually still in a learning situation, and having them write down the items actually helps you to evaluate and also the student to be able to comprehend the different components of the care plan. Is the worksheet the students have learned to use similar or different from your approach? Would you like the student to use this format or perhaps one that you've adapted in your practice site? As long as the elements of the worksheet are addressed, the format can be changed to fit your practice. A couple little tips as well. Remember, the worksheet is not a documentation form. Documentation should flow from this worksheet. However, it's important to discuss with the student what components of the pharmacy care plan are actually suitable for documentation, all while keeping in mind the audience that you're trying to communicate to. When you're providing feedback to your student on each component of the care plan, it's important to assess it for completeness. Also, check to see, is it reasonable? Is it an acceptable plan? If not, which aspect of the plan is unacceptable or requires improvements? And how would the student go about making those types of changes? When you evaluate your student, use the checklist that's provided to review their written care plan and also provide written feedback as required by the course. One little tip here too, it's important to ensure that the student is developing specific monitoring and follow-up plans that the pharmacist will conduct. After course requirements for written care plans have been satisfied, you need to determine and communicate to your student the ongoing format you would like them to use. Whether it be a verbal presentation, or it could be a written assignment, or maybe it's a bit of both. And this decision can be dictated by your student's demonstrated ability and knowledge level. So if they've done a great job on their written care plans, maybe they're ready to move on to a verbal approach. So for courses that require the development of a care plan, a checklist will be provided by the faculty in the course manual. Here is an example of that checklist, and you will note on the bottom of each section There are different criteria for you to take a look at and check them off to make sure that they appear in the student's care plan. Any deficiencies can be highlighted and discussed, and it would be important to allow the student a chance perhaps to remediate at that point and discuss what additional things they'd like to include in the plan if it's missing initially. To summarize, here's an overview of the preceptor role. So before the clinical placement, make sure you're familiar with the pharmacy care plan process that the students are taught at the faculty. Know the number and variety of care plans that are required by the faculty. When the student is with you on clinical placement, early on in that rotation, make sure to provide them with plenty of guidance on implementing care plans. Get to know your students' strengths and their areas for improvement, and discuss your expectations for creating and implementing each element in a pharmacy care plan. Discuss when and how you will provide feedback and evaluation on their activities. A little bit later in the rotation, as they master some of the earlier skills, it would be important to challenge the student with more complex type patients and evaluate them further. So I just want to tell you a little bit about my practice. I'm a clinical pharmacist with Alberta Health Services and also a clinical associate professor at the Faculty of Pharmacy and Pharmaceutical Sciences in Edmonton, Alberta. I also work at the Northern Alberta program in the Royal Alexandra Hospital site. At that site, we serve about 1,500 patients who are HIV positive, and that's anywhere from Red Deer to the north of the province. We have a large catchment area. At our specific site at the Royal Alec Hospital, we have about 500 patients or so that we care for. I work on an integrated multidisciplinary team, consists of social workers, nursing, pharmacy, staff, as well as physicians. We also have a psychologist and a dietitian. Pharmacists see the patients with the physicians and are involved in the decision-making process right at the time of prescribing, which is excellent because we can be proactive in our care rather than reactive. As pharmacists, we deal with antiretroviral selection. We're also consulted on resistance and some rather challenging cases, I might add. We monitor and manage adverse effects and interactions. We also play a large role in adherence issues and other disease states, including lipid management, diabetes, smoking cessation, and depression. We're also strong advocates for seamless care, and we're very actively involved in this process. So we work with community pharmacies and agencies, primary care physicians, inpatients as well, if our patients happen to be admitted, and the prison system to make sure that our patients have seamless care and seamless therapy on a chronic basis. So the data collection process and the patient assessment are really key components to caring for this population. This is done via patient interview, chart review, discussion with other caregivers and healthcare workers. And I also take time to review the lab work as well as the medication profile in NetCare. And often I'll also call the community pharmacy to make sure that I have a very complete medication profile. After this work is done, the pharmacy care plan process flows from the initial assessment piece. My approach to precepting a student through the pharmacy care plan process would be to review a patient that I have assessed first, to bring to life the various parts or aspects of the care plan. This way, students can understand how to establish goals of therapy, what my thought process is regarding the therapeutic alternatives, and how I, as a clinician, balance out the pros and the cons of various therapies. After the assessment of these alternatives, I would then provide the treatment recommendation and plan. At this point, I review with the student how this is communicated to the team. So how the monitoring occurs, both for efficacy and side effects, and which team members would follow up with the plan. In many cases, it is the pharmacist who is responsible for the follow-up. So that would be very clear who is doing the follow-up in the team. However, in other situations, it's the whole team who might follow up jointly at the next clinic visit, and yet in other cases it may be our psychologist, say if it's a patient who's depressed and coming in for counseling, or the social worker. So as a team we work together and we know our roles and understand them. It's important to stress too that documentation would then flow from the care plan, and I would show a student how to document based on that. It's also important to note that there are parts of the care plan, although they're important, that are maybe not appropriate to document in a chart note. So once an example of the care process is demonstrated to the student, it is now their turn to try it out on a patient and to practice. And I would guide them through the different steps and components of that. I hope that by walking you through the patient care process and also demonstrating how I would precept it, in particular the pharmacy care plan, that you are able to better precept your students and that this translates into ultimately better patient care. Thanks.